لو دخلت العيادة ولقيت المريض ده قاعد بره مستنيك هتفكر في ايه؟ الميديا اطلقت على المرض دوت The Burning Man Disease ويعرف طبيا باسم Erythromelalgia. الإريثروميلالجيا is a rare chronic pain disorder poorly understood. It is hard to treat ومصاحب ليه severe distress and poor quality of life of the affected patients. In Greek كلمة erythromelalgia تنقسم إلى erythro means erythrose أو red, milos أو limb وalgia meaning pain يعني red painful limbs. Etiologically the disease ممكن يكون primary with specific mutations in the SCN9A gene أو ممكن يكون secondary to other diseases or drugs أو لو ما فيش سبب ظاهر بيطلق عليه idiopathic erythromelalgia. في البرايمري أو inherited type of erythromelalgia الجيناتيك ميوتيشن اللي موجودة بتأثر على certain type of channels known as the NaV1.7 channels. النوع ده من الchannels are voltage gated sodium channels preferentially expressed in the peripheral nervous system within sensory and sympathetic neurons. دورهم ايه؟ ان هم ليهم a critical role in the generation and conduction of action potential in peripheral neurons. The peripheral neurons دول are the ones associated with excitability of sensory neurons. الجيناتيك ميوتيشن اللي موجوده في البرايمري اريثروميلالجيا is a gain of function type of mutation وده بيؤدي ان الناف 1.7 صوديوم شانلز ديت بتبقى in a state of sensory neuronal hyperexcitability with low pain threshold وده بيشرح لنا ليه البيشنتس اللي عندهم اريثروميلالجيا بيبقوا بيشتكوا من severe unbearable pain لان الناف ريسبتورز زي ما قلنا برضو موجوده في السمباثيك نيرونز. الميوتيشن دي في السمباثيك جانجليا is associated with العكس بقى hypoexcitability leading to failure of vasoconstrictive mechanism في البريفرال vessels وده بيؤدي الى state of persistent vasodilatation واحنا بنبليف ان الفازودايلاتيشن ده بيبقى responsible for the redness and hotness we find in erythromelalgia. Additionally, it seems in the peripheral vascular system plays a major role in the pathogenesis of erythromelalgia. ليه؟ لأن في الإريثروميلالجيا بنلاقي إن في persistent opening of the arteriolar venular shunts between the superficial والdeep plexus وده بيحصل مع increase in body temperature وده بيؤدي to bypass the capillaries والcapillaries دي هي المين oxygen supply للسكن as well as nutrients فبالتالي هيحصل لي hypoxia a well documented cause للacute and chronic pain لأن في increased arteriolar venular shunting in the skin بيحصل erythema, warmth and swelling that accompanies the attack of erythromelalgia ويبقى كل ما العيان هيتعرض لحراره الارتريولار فينيولار شانس هتشتغل وهيقل البلاد سبلاي للكابيلاريز وهيحصل هايبوكسيا and all associated symptoms of erythromelalgia. الريسيرشرز كمان لو expression of the NaV1.7 channels within the vessels of the arteriolar venular shunts in the skin وده further proof of their dysfunctional role in primary erythromelalgia لان الارتريولار and venular shunts ديت موجوده باعلى density في البريفرال and acral skin. The preferred sites of erythromelalgia are the hands and feet as well as other acral areas زي الايرز والنوز. مش بس كده لا ده كمان ال presence of NaV1.7 channels within the vessels of arterial venular shunts is more proof in their dysfunction has an important role in primary erythromelalgia. Secondary erythromelalgia can be associated with myelodysplastic disorders which is the most common like thrombocytosis and polycythemia rubra vera and can be also associated with connective tissue diseases like lupus and dermatomyositis can be iatrogenic with cyclosporin and statins associated with HIV and can be due to miscellaneous disorders like diabetes and malignancies. The pathogenesis في secondary erythromelalgia is believed to be caused by platelet activation and aggregation وبعدها بيحصل thrombotic occlusion و proliferation of intima and smooth muscles وده بالأخص بيحصل مع حالات المyeloproliferative disorders ولكن في كتير من العيانين بنلاقي عندهم neuritis مأثر على normal functions of peripheral blood vessels. من الميدياتورز المهمين في الإريثروميلالجيا والبروستاجلاندينز. الكلينيكال picture does not differ greatly between primary and secondary erythromelalgia with the exception ان البرايمري erythromelalgia ممكن تظهر بدري before the age of 20 ولكن السكندري غالبا بتظهر بعد سن ال40. البريفيرد سايتس زي ما اتفقنا are the distal extremities, palms and soles ولكن ممكن تظهر في اماكن اخرى زي النوز والفيس. It is usually bilateral and symmetrical ولكن بعض حالات السكندري erythromelalgia ممكن تكون unilateral. البيشنت بيبريزنت with episodes of severe burning pain, erythema, and increased temperatures that last for hours وممكن كمان تبقى chronic موجودة على طول. These episodes are triggered by exercise and heat exposure and dependence. الحقيقة ما فيش specific investigations for erythromelalgia ولكن في secondary erythromelalgia ممكن نعمل CBC to detect myeloproliferative disorders. Genetic testing is only beneficial in primary erythromelalgia. Underlying causes like connective tissue disease and others may be investigated. Nerve conduction study and thermoregulatory sweat testing may be helpful. وskin biopsy للأسف is usually not specific for this disease. The differential diagnosis of erythromelalgia may include Fabry's disease with multiple organ affection, including the nerves, heart, and kidneys, and the early symptoms of episodic burning pain in the hand and feet. But in Fabry's disease, we don't have erythema, warmth, and symptom relief by cooling like erythromelalgia. We may also find the characteristic angiokeratomas over the skin. In reflex sympathetic dystrophy, there must be a history of trauma and there is no relief with cold exposure. In Raynaud's, we have well-demarcated pallor followed by pain and cyanotic discoloration, which resolves with warming and blushing of the skin. In contrast to erythromelalgia, which is relieved by cooling, not warming. In patients with peripheral neuropathy, recurrent pain in the extremities may be a symptom. However, there is no redness or warmth like erythromelalgia, and there is no specific triggers. للأسف, erythromelalgia is hard to treat. We should first avoid triggers like excess exposure to heat, extreme exercise, and long standing. And this requires lifestyle modifications. Sodium channel blockers can be used especially in primary erythromelalgia, but they may also work for secondary type. These may include Mexilitine, which is an antiarrhythmic drug, Carbamazepine, and lidocaine, topical or even IV in severe cases. Other reported drugs have included aspirin, especially in secondary erythromelalgia due to myeloproliferative disorders. Serotonin blockers like sertraline may modulate vascular tone and reduce platelet activation, especially when they combine with norepinephrine reuptake inhibitors. Prostaglandin analogs like misoprostol have been reported beneficial in some cases, but paradoxical reactions have also been reported. Cyproheptadine, gabapentin, magnesium, and capsaicin topical creams have all been tried with some success. There is also some procedures which may help patients with erythromelalgia like sympathectomy and epidural blocks. Thank you very much.